There's been a lot of debate about what role radiation ought to play in treatment of patients with gastric cancer resected for cure. And the data is conflicting. There have been some studies that have shown value to preoperative radiation. There have been some studies that have shown value to adjuvant radiation, including the McDonald intergroup study. But the CRITIC study that was just presented for the first time randomized patients to perioperative chemotherapy or perioperative chemotherapy with radiation following surgery. And it basically showed no value to the radiation in this setting. Now, this is a little bit hard to put in context with all the other studies that we've done, but all of these patients had D2 resections, and there have been many, particularly from other countries besides the US, that have criticized the intergroup trial for inadequate surgery, and that is the reason that many believe that radiation was helpful for those patients. As our surgery has gotten more aggressive for gastric cancer, the value of radiation has become more and more in question, and it's hard to give. If you give patients chemotherapy before surgery, then do a big gastric surgery on them, they're pretty beat up, and you only want to give radiation if you know it's really helpful. It's not going to be part of my standard approach to these patients in the future.